We will discuss about pyelonephritis. Now, pyelonephritis, I already discussed the journal pyelonephritis and acute pyelonephritis in the previous video. You should watch that video prior to watching this video to get the concepts correctly. So, what is chronic pyelonephritis? So, it falls in the range of tubulointerstitial nephritis. Okay, so it is tubulointerstitial nephritis, but here the condition is chronic. So in if it is the condition, this is chronic, but here what will happen here is there will be acute exacerbations. So chronic pyelonephritis will also have some episodes of acute pyelonephritis, and as the disease is chronic, there will be fibrosis associated, and therefore the patient will have renal scarring present. Now, it is a very important cause of end stage renal disease, especially in children, because of some reasons which you will see which are common in children. Now, going to there are two forms. If you see how the chronic pyelonephritis is formed, there are two forms. First is the reflux nephropathy, and second is due to any obstructive causes. So acute pyelonephritis differs from this chronic pyelonephritis, that the condition is ongoing. So there is chronic, to need it to be chronic, the condition should be permanent. So there are two forms. First is the reflux nephropathy. Now what happens here is, this is the more common form than the obstruction one. So in that previous video I discussed about vesicoureteral reflux. Now what is it? So what happens is, this is kidney, this is the ureter, and this is the bladder. So whenever the person goes for micturition, the urine has to flow from the bladder into the urethra. Okay, but what happens in case of vesicoureteral reflux is that the urine from the bladder goes back into the ureter because of absence of the intravesical portion of the ureter. So this is because of this condition, the vesicoureteral reflux can be congenital also. So because of this reason, and due to intrarenal reflux, and this urine can go into kidney also, and there is intrarenal reflux also. So because of this reason, the condition from acute pyelonephritis will go into chronic pyelonephritis. Okay, so this is again seen in children because of congenital vesicoureteral reflux. Now, if the reflux is unilateral or bilateral, depending on that, the one kidney or both the kidneys will be involved. Now, second reason for chronic pyelonephritis is the obstruction. So because of any reason, whenever there is obstruction, it will lead to recurrent infections, and therefore recurrent infection will lead to chronic pyelonephritis. Now here also there can be reasons. Now there can be reasons such as calculi or any other obstructive anomalies of the ureter. Okay, so calculi mostly will be seen in one ureter only. Okay, so if you are seeing this kidney, so in one ureter if there is obstruction, okay, so the unilateral kidney will be involved. However, in case of posterior urethral walls, both the kidneys can be involved. Now what is posterior urethral wall? It is not normally present. Okay, so here what happens is, this is the bladder, okay, and this is the urethra. Now because in some persons, in some children specifically, especially boys, sometimes there is a valve, there's an extra tissue present that is known as posterior urethral wall, because of which the urine is not able to flow from the bladder to the urethra properly, and therefore there is obstruction. So this can again lead to chronic pyelonephritis. Now how is the morphology? Whenever we see the kidney grossly, how will it look like? So firstly going to the gross morphology, then we'll go to the microscopy. The kidneys, because there is repeated episodes of chronic inflammation, and there are repeated episodes of fibrosis, so therefore there will be scarring present. The scarring will be present, and with the scarring, if you see, the scarring will differ, that it is asymmetric scarring. In case of chronic glomerulonephritis, if you see chronic glomerulonephritis, here the scarring is diffuse and symmetric scarring is there. But in case of your chronic pyelonephritis. Okay, the scarring is asymmetric. Also, one thing to notice that if this is your kidney, the scarring, in if it is reflux nephropathy, if the reason behind the uh, chronic pyelonephritis is reflux, so mostly the reflux, if takes place, goes to the poles. So only the poles will be involved in case of reflux nephropathy. However, if the reason is obstruction, whole of the kidney, from the poles, from here, it will be involved. So you will have scars on the kidney, and the calyces will be dilated, and the papilla will be flattened. So these are the gross picture of the chronic pyelonephritis. Going to the microscopy. Now microscopy in pyelonephritis, there in the kidney, there are three things. There is tubules, you have interstitium, and you have glomeruli. Okay, so tubules and interstitium are more involved than the glomeruli. Okay, so in tubules, what you will see is mixture of things. Okay, you will see some tubules which are atrophied, some tubules which are hypertrophied, some are dilated, and also some dilated tubules. So if this is your tubule, this tubule will contain something eosinophilic inside of it. Okay, and this resembles the thyroid gland. Okay, therefore it is known as thyroidization of the tubules. So these are the actually they are colloid casts present. This is known as the thyroidization of the tubules. Also you can see there will be in the interstitium, you will find chronic interstitial inflammation. That means many lymphocytes will be present there, and there will be fibrosis. Glomeruli, mostly what will they will show is that this is glomeruli. Around the glomeruli there will be periglomerular fibrosis present. So here you can see in this diagram, you can see over here, this is your interstitium, and here this lots and lots of blue color, these are the lymphocytes. Okay, so interstitial inflammation is present. Then this is your glomeruli. Okay, glomeruli shows fibrosis. That means periglomerular fibrosis is present. And then you have your tubules. Okay, so in tubules, you can see very clearly the eosinophilic material which is present. This eosinophilic material is known as thyroidization of the tubule. So this was about the gross and microscopy. Now there is a specific type of chronic pyelonephritis known as xanthogranulomatous pyelonephritis. So what is the word xantho? Whenever you will see here the word xantho in pathology, it goes to macrophages. Okay, so in xanthogranulomatous pyelonephritis, it's a rare form of chronic pyelonephritis, and what will be there? There will be many foamy macrophages which are present. So here you can see many macrophages. These light color ones, these are macrophages. So it is just that there are collection of macrophages which is present along with other chronic cells, chronic inflammatory cells such as plasma cell, lymphocytes. So this is xanthogranulomatous pyelonephritis. It is a type of chronic pyelonephritis only. Now going to the clinical features, we'll briefly discuss about it. Here the patient will compare of back pain, fever, pyuria, bacteriuria, and also hypertension in children can also be present. And on the radiographic investigations, you will see that there is asymmetrically contracted kidneys along with coarse scars and deformity of the calyceal system. So this was all about the chronic pyelonephritis. Do watch the previous video also, because the pathogenesis is, you will be more clear with that. Do like, share and subscribe to this channel if you like these type of video. Thanks for watching.